manufacture, distribute, and I think 1 out of the 3 tablets in the America comes from the Indian manufacturing locations. I think we are on the right track to become that.
Mr. Handa, please, if you don't mind. Then after that, maybe I will come back to you, and then I will share some thoughts from my own side.
Let's track the history of how the economies have become superpower. If you look at the car industry, that brought American as superpower. The next innovation they did was in nuclear power. And that made them superpower in terms of how they dominate and control the world, including the surveillance they do it. Now, if you look at the pharmaceutical industry, being the topic of this, is whether India is a superpower or China is a superpower. I don't know how many of you know that we have 2 standards of manufacturing. My friend is sitting here, but I will still take that liberty to say that. There's 1 standard for exports and 1 standard for Indian manufacturing. How can you be a superpower with these 2 standards? You can't. And look at the mushrooming manufacturing bases you have, 20,000 and odd. How can you be a superpower with 20,000 odd manufacturing units? Look at the regulations you have. You can launch a product without doing trials. How can you be a superpower without knowing the efficacy and safety of the product? I think there's a long, long way to go before we call us a superpower in pharmaceutical industry. Now, if you want to comment on the China superpower, I think we'll discuss that later on. Let's move on with the discussion.
To you, sir. Once again.
I think as Kewal has mentioned about 2 standards, in the pharma world, there are also 2 standards of generic drugs. One is generic, and the other category. So now if you look at where is pharma going forward, I would place severe stress on discipline of the pharma industry. I believe recently the red flag story of Ranbaxy may be an eye-opener to the entire industry, because I think to correct that, pharma industry of India will need to invest heavily in a public relationship exercise. This will be very important, because if US dumps or the adaptation rate of branded or non-branded pharma, generic pharma declines in the United States, this will have a severe negative impact on the entire pharma industry. Remember, pharma industry cannot only support its economy on the indigenous market. It is very much an export-dependent market. And therefore, you don't want, just like manufacturing shifted from United States to China, the last thing you want to do is majority of pharma manufacturing molecules, large and small, to be shifting to China. I think that is something that we need to play with caution, and I would advocate a strong public relationship exercise.
I just want to add there, in pharma industry, you are a superpower not because you're a manufacturing base. You're a superpower because you're an innovator, you're a creator, you bring new chemical entities in the marketplace. Talk about it, how many new chemical entities has India brought in the marketplace? We don't have iPads, we don't have Facebook, we don't have Viagras. How can you be a superpower without these big things which are globally brand name? To be a superpower, you have to have a global brand name. And if you don't have a global brand name to NCE, you can never be a superpower in pharma.
That's interesting. Can I share my thought on this? Then maybe we can go a step ahead in the direction of what we can do. We have heard views from our experts that it is not really that easy to become a so-called superpower. Okay. By and large, every panel member has agreed that if we are trying, we are on the right track, you're going to be a superpower, but not yet. Yeah. Okay, so be it. So may I request that we forget the word superpower for the time being? Okay, it's like Sergei Bubka, the famous pole vaulter from Russia. Somebody asked him, "What's your target?" He said, "My target is 1 inch above what I did yesterday." Okay, so be it. So may I request that we forget the word superpower for the time being? Okay, it's like Sergei Bubka, the famous pole vaulter from Russia. Somebody asked him, "What's your target?" He said, "My target is 1 inch above what I did yesterday." his target is 1 inch above what he did yesterday. He was a pole vaulter. So if you believe in that kind of an approach to improving things, let's not cry hoarse on, oh, it's happening there, it's happening here, we are not doing it. Instead of that, can we look at how incrementally we can do better in whatever we are doing? In whatever we are doing, whether it's clinical trials, whether it is research, whether it is innovative marketing, whether it is communications, whether it is IT, can we do anything even slightly better tomorrow than we are doing today? What do you think, madam?
So because I'm a big proponent of technology in pharma, let me give you a perspective from that angle. I have written 5 papers on counterfeit drugs already.
What?
Counterfeit drugs already. And I have read around 200 of those. It's not to mention, but we have got a very bad name when it comes to counterfeit drugs across the world. People have even quoted 60% of drugs that are being imported from India are counterfeit. I personally feel that technology has a big role to play, and it also came up in 2012 when there was a consensus that all of these packagings will have some unique ID numbers or several different kind of chromatic, non-chromatic technologies to find out counterfeit. But then it was only made for drugs that are to be exported to other countries. In India, you have to look for some other methods also, because superpower is not just when your sales actually rise from some billion dollars to the certain $1 billion, which they propose that today it is around $11 billion, US billion dollars, and in 2020 it will be 70, which is quite a big number, around 7 times. I personally feel that you have to do it on both sides. It's about strengthening your own culture and country, at the same point in time making it empowered enough to deliver. In India, and I understand that we have many people here who are from Aam Aadmi Party and so on and so forth. When we actually buy a drug, do we ever buy a full strip? The answer is no. We buy a single pill. Now, if the unique number is there on the foot strip, and I SMS it and I get to know, well, this is authentic, the second time I try and do that with the second pill, it will say counterfeit. So the whole gamut of activities, what Mr. Hariwala said, what I am saying, and what other eminent people are saying, it's because of the fact that somewhere the policy is lacking. Somewhere what needed to be done or thought of in the first place before we actually implement certain things on the ground was not thought of. So I personally feel that yes, technology can play a great role today in capturing, monetizing, monitoring, and managing some of these things, not at a level of India, but internationally as well. And I personally feel that somewhere when you're doing these policy advocacies at the center, this should be taken into consideration.
Thank you. I'll dwell on this a little more with your kind permission. You mentioned the case of adulterated, spurious drugs, correct? Way back in 1970, when I went to Cleveland, as a sort of a postdoc fellow, I was in Western Reserve University. I worked there for 4 years. Within a couple of weeks of my joining there, my professor asked me, I'm told that in India, you never get pure milk. I said, what do you mean? It was all news to me coming from Pune. And then he said, you never get proper kerosene. You don't never get proper this, proper that. And I vehemently, opposed whatever he said, partly out of ignorance and partly out of patriotism. More out of ignorance. And just 2 days ago, I was in my village. I do my own charity, in a very limited way. And I asked those guys, Rakel Kutunat, you wouldn't understand Marathi. So he said, oh my God, that Rakel we get is all, 50% of it is water. The Rakel is kerosene, okay? It floats on top and down below is just water. 2 days ago and 42 years ago, situation is about the same. Now, you see, I'm not, I don't want to cry the political crocodile tear kind of a thing. Why are we finding it so difficult to take care of, spurious drugs, in your view?
Well, there are 3 reasons for that. Number 1 is the human capital, or what we call as people in India, are not taken care the way a US would do for its citizens or a UK will do for their citizens. And there are several examples to say. I don't want to cry about a lot of them, including insurance, house, shelters, sanitation facilities, communication facilities, and so on and so forth. But I personally feel that there is a lot of bureaucracy, and what we require as of now today, probably we never needed an Arvind Kejriwal of this world to actually come and teach us what we have to do and what we have not to do. But when adulteration actually crosses a limit, it actually tests his patience. You know, you talk about kerosene. If in kerosene some adulteration happens, I can still take it. Maybe I'll get a little more smoke, or maybe it will not ignite at the right temperature or whatever else. But when it comes to that active ingredient in a drug that is life-saving, it becomes a big concern. And especially when you are saying that you are a manufacturing hub for the world and you are passing on that same legacy to different other countries, then it makes a bad name. At that point in time, then you don't think about the superpower part or every other part. I also sit at the center with European Commission and several other organizations to advocate policy. And to be frank, if you ask me what is the reason why we are not able to do it, I have a ready answer for you. And the answer is, I don't know. There are several ifs and buts to this, and I have not figured it out, but would love to listen from people here, and because the panel is on the other side of the dais also, if they have figured it out as to why it's not happening.
Yeah, please.
Well, every developing country goes through this process. What we are discussing today, a couple of years back, it would have happened in the same way in the US also. Duplication of drugs in an unregulated market like India, where our daily challenges are different, it's very difficult. A solution to this could be all the pharma industries who lose a lot of revenue and the country loses a lot of people because of duplicate drugs. Unless and until the pharma industries don't take the initiative of having their own set of teams who can track duplication of drugs and bring it, report it to the authorities. Because the law enforcing agencies today in this country are a complete mismatch to the population of the country. Like for example, the population of Mumbai is beyond 2 crores and we expect 60,000 police force to control that population. It is practically difficult. Like if a family has 2 kids, you can make them engineers and doctors. If you have got a family of 200 kids for a couple, it is impossible to control them. That is the situation of the country today. If the pharma industry can really seriously join hands with the law enforcement agencies in a big way, whatever the bureaucratic hassles, whatever the bureaucratic hurdles, if they bring it to the notice of the law enforcing agencies and follow them up for taking actions on the people who are manufacturing duplicate drugs, it will save a lot of lives of this country. At the same time, it will also save a lot of revenue of the companies who invest big money in R&D, manufacturing, distribution, etc. I would also like to mention that every developed country in the world, every developed company in this world has been backed up by very intelligent Indians. It's high time that they need to come back to the country. Already the brain drain concept is gone away. A lot of successful Indians staying abroad are coming back to this country, and that is what is required. And these people will now create that kind of wealth. Expenditure in the economy is money to the people. That is a simple law of economics, which is now happening. Like I said, rest of the world will develop India as a great country because they see India as a huge market. One fact cannot be ignored, that there are more people dying in this country out of lack of medical facilities than terrorism. We all know this for a sure fact. I think the pharma industries can definitely play a fantastic role. Mr. Handa is already anxious to continue what I'm saying.
Oh, I would just want to give you one. I mean, what you said looks fine. It has been tried it out, and I'll tell you why it has not worked also. There was this pharma secretary in this forum, which was packed by 1,000 people, one day said, he was crossing through Agra Road, and he needed some medicine. So he asked his driver to stop in the next medical shop. The driver told him, यहाँ पे मत रोको, यहाँ पे नकली दवाई मिलती है. अच्छा, वो बोला वहाँ पे ले जाओ जहाँ पे असली दवाई मिलती है. Then I asked him a question, what did you do with that information? If a pharma secretary is helpless, cannot act with that information, एक आम आदमी क्या करेगा? Now, the power, the IPA and others joined hands together, exactly what you're saying. There were about 15 companies who joined hands together to track the counterfeit map. This is a 4 years record which we did, and I was part of it, the tracking process. We went right up to the factory gates, and then we were stopped by the politicians and the underworld. This is so entrenched strongly, and this is a controlled, and the posters, sorry to tell you, it is either a homeopathic poster up or it's an Ayurvedic drug poster. And inside is the allopathic medicines that gets manufactured. So they take the shelter of emotions of homeopathic and Ayurvedic manufacturing to manufacture allopathic drugs, counterfeit allopathic drugs. We raided one chemist shop selling imported life-saving medicines. I'm not going to scare you, but I'm just putting the facts. It was counterfeit, spurious. The life would have never saved, he would have died immediately. We asked the chemist, can you show me a proof? Where have you imported this medicine from? His answer was, thैली में कोई दे जाता है, हम ले लेते हैं. All these life-saving medicines have a backyard counterfeit production happening today. You go to the best of the chemist shop, there is one AOCD secretary here, and I'm going to tell you in front of you. You go to the best of your shops, and they cannot guarantee you this imported life-saving medicine is genuine or fake. That is the type of corruption and greed that has happened, the greed to make money faster with counterfeit products. The corruption of the bureaucrat and politicization of manufacturing has led to. Power has to go to the Aam Aadmi and to say that if this unit is selling, this unit will not be allowed to manufacture here any products. That's something we need to do it.
Thank you.